We're here at Social Health 2010, the inaugural event for social media and healthcare. And I'm here with Doug Ulman, CEO of the Livestrong Foundation. I believe that's what it's called, the full name. And Doug just gave a wonderful talk on his experience as a cancer patient and how social media has sort of changed the way that people are doing things, both from a patient perspective as well as a nonprofit perspective. So just a few questions for you, Doug. Firstly, thank you very much. That was a wonderful talk.
Thanks for having me.
Really glad to have you here, especially in your hometown. So I think the first question I had was really around being a patient and how it's changed over time. You talked a little bit about how you did things when you first found out in the 90s about your diagnosis. And I was just wondering, with the tools that you've seen evolve over this time, how has that changed what a patient can do, and what do you think would be different now if you found out now?
Sure. I mean, as you can imagine, being diagnosed with cancer, the experience is so overwhelming and frustrating in any regard. But then to have the burden of trying to track down information sort of in an archaic way of finding books and libraries and things like that, which is what we had to do years ago, is just a huge burden on an individual and a family. And so social media has changed that. It's allowed patients to interact with one another immediately, learn from others' experiences, and make better informed decisions on their treatment options based on what they learn in real time. And so it's truly trailblazing the healthcare industry.
Excellent. And in that sense, I think social media has also been a big part of the way you promote what Livestrong does. I'd like to just understand a little bit about how you're using it, and also how you've seen, you talked a little bit about the past, about mailing out newsletters. How has that changed with social media, and what are you doing these days that you found to be the most powerful?
Well, I think that social media has changed philanthropy, and it's changed the social sector. So one, it's changed philanthropy because everybody can participate now. It's easy to go online and engage in a cause or an organization or a movement. And two, it's allowing us as a sector to be very transparent. So it's allowing us to communicate in real time with people who care. So as years ago, we used to mail out these newsletters and staple them and print them and address them. You know, those are the days of the past. Now we can communicate immediately with millions of people who we already know care about our cause. And we can create a dialogue that allows us to understand the needs that they have and understands what they want to see out of this movement. So we pose a lot of questions to cancer survivors. We say, would this be helpful? And we look at the results, and we create programs based on this real-time interaction with people and their families. And so it's totally transformed the landscape of philanthropy and the social sector.
Excellent. And on that note, I guess, what advice or what message would you have for other areas of healthcare based on your experience with social media helping you drive your nonprofit organization? What other lessons do you think you can take from that and apply to other parts of healthcare?
I think that healthcare in general needs to become much more transparent. So I would encourage folks to use social media actively, but be open and transparent. That's not traditionally what big corporate America has done in healthcare or any other sector. But I think the benefit of that is that as soon as you start to engage the patient community and the advocacy community, the ultimate impact will be so much greater. And so the more open and transparent everybody involved in the healthcare sector is, whether it's pharma, whether it's the insurance industry, whether it's patient advocacy groups, the better the results will be. Because this problem, the problem of healthcare in the United States or around the world, is not going to be solved by one of those entities. It's going to be solved by everybody working together.
Great. Well, thank you very much, Doug. I think it's wonderful the work that you're doing, and also just the presentation you gave really talks so much about the personal experience and how social media can really make a difference among many people, not just one person. Thank you.